Today we came together and there was an opportunity for us to think about cancer services across the East of England and the improvements that we want to make for our patients.
Meetings of cancer alliances like this are a fantastic opportunity to bring together the healthcare professionals and the patients. We know that we have many more people than ever before being referred for investigation of cancer and being treated for cancer. But this is an opportunity to look at what we can put in place, the solutions we can find together to make this work better.
I think it's been phenomenal to be able to interact and network with like-minded people, and I think we all really enjoyed the showcasing of co-production, the importance of co-production moving forward, and how it can really help with patient outcomes.
Co-production is a way of involving patients and the public, where the patients and public are equal partners in the design, the management, the decisions and the running of the project. We're actually there around the table all the time, taking an equal part in the project team.
The Darzi report that's just come out says the patient voice isn't loud enough. They haven't heard me, not when I'm trying. We need to make it louder, we need to make it clearer. It makes sense, operationally, strategically, financially, to have patients in the room, to have them involved in the decisions. Because actually, if you don't, you'll end up with, imagine designing a Cineplex centre or retail park without talking to people who might use it. And if you don't do it, you're going to have to revise your plans a lot more, or you'll end up with a product, a service, a building that could be a lot better, that people will use, but which they'll grumble about.
I really enjoyed the discussions around strategy and strategy of the Cancer Alliance. Also found the patient and public involvement sessions really useful. It's something that is incredibly important but easy to forget when you're developing something new, particularly if you're in quite a scientific field and you're focusing on the technology and the science of it. It's really important to bring patients into that part of the journey. It was validating what we're doing and learning how we could improve that.
We know that about 35,000 people aged 25 to 49 are diagnosed with cancer in the UK every year. And we're talking about hundreds of thousands of people across the country. So, it's about 1 in 10 cancer diagnoses, but that adds up to actually a lot of people who are at the peak of their working life, looking after children, maybe looking after their parents. And we need to be paying attention to this group of people.
I think for us, the key takeaway from the discussions we've had is that we'd really love to work more collaboratively, particularly with the rich local data we have. So working then with the data and local flexibility in our services to really try and drive the increased uptake of screening in our population.
Well, it's been a very informative day, and I have learned a lot as well, and I'm really pleased that I'm here. And I think it's important, everything that I've seen today, trying for awareness for early symptoms of all cancers.
I really hope that we do another one of these really soon, because it's such a great opportunity for us to come together and learn. But more importantly for us, it's a really great opportunity to celebrate the hard work and the dedication and the integration of our patients into things like patient advisory groups and in patient co-production.
We know how hard the NHS is working. As a charity partner, we're always really happy to come and speak and to collaborate with partners in the system to make sure that patients get the best possible experience. I'm sort of the opinion that no one organization can meet all of the needs of a patient, and so actually the more we can collaborate together, I think the more important it is.
This day, I think, is a great celebration of what we've done already in the East of England. However, I think the key thing as well is to avoid complacency, and we realise that we've got a huge amount of work still to do. One of the functions of today is getting all the various people from the East of England come together to discuss the strategies with the idea of forming concrete plans about how we can take things forward.
I think if there was a theme that really, like a strand that flows through the day, is around how important it is for us to be talking to and engaging with our patients. Their involvement in how we design services, how we deliver services is really important. We need to be listening to them. Ultimately, it's their experience that matters, not our experience. So working more with patients, and we have done that through today. We've had patient representatives in every session, in every workshop, and a number of the talks and the conversations we had were very much around how do we do that.